Okay. Hmm. So in oncology, you have the various types of doctors who are working and treating cancer patients. You have the medical oncologist. Medical oncologist is the one who treats cancer with drugs. Basically, he's treating solid tumors and also he is treating hematological malignancies. Radiation oncologist is the one who gives radiations in different ways to the cancer patients, and the radiation oncologist can also prescribe chemo, and sometimes they do prescribe chemo if in the hospital or in the center where he is working there are no medical oncologists, then he himself can give chemotherapy, right? So they are also important for us. So surgical oncologists, they treat cancer by doing surgery, but in at times they also prescribe chemotherapy, or they also write hormonal therapies and some oral therapies. So, if uh, in a setup the surgical oncologist is there, but a medical oncologist is not there, then the surgical oncologists by themselves give chemo, which are to be taken after the surgery, that is in the adjuvant setting. Okay, and they can also prescribe some oral treatments and hormonal therapies which have to be continued. Hemato-oncologist is the one who treats all the blood related disorders like all types of leukemias, all types of lymphomas, and your multiple myelomas. All these are being taken care of by the hemato-oncologist. You have hematologists who don't treat cancer, but they treat blood related disorders, and even they treat lymphatic system related disorders. But hemato-oncologist treats all the blood and the this lymphatic system related cancers. Okay, so that's the difference between hemato-oncologist and hematologist. A pathologist is a special doctor who examines body tissues and organs under the microscope, especially they are the ones who will visualize and analyze the biopsy report and the various marker tests. Yeah. Now, after seeing what is chemotherapy, we'll see all the side effects associated with chemotherapy. One is your myelosuppression, which is nothing but bone marrow suppression. That means either the WBC or your platelets or your RBC counts are going down. So that is myelosuppression. So in myelosuppression, you have some subclassifications like low WBC levels is called leukopenia. If the WBC levels are low, then it leads to a condition called leukopenia. If the low platelet counts are there, then that is thrombocytopenia. If low RBCs are there, then it is anemia. This is one of the major side effects of chemotherapy. Then you have GI side effects, acute or delayed. Hmm. Acute is what you get suddenly delayed, which happens over a period of time. It can also cause dehydration. It can be treated with antiemetic agents. Okay, acute or delayed nausea and vomiting associated with chemotherapy. Acute or delayed nausea and vomiting associated with chemotherapy is also called as CINV. This chemotherapy induced nausea and vomiting. Okay, so it can of course cause dehydration. Therefore, antiemetics are given like your palonosetron, granisetron, ondansetron, your aprepitant. Such agents are given for treating chemotherapy-induced nausea and vomiting. Have the other GI side effects like anorexia, that is loss of appetite. Anorexia is loss of appetite. The patient does not feel hunger, does not feel like having food. So that is a very common side effect and it is called as anorexia. The other GI side effects are gastritis and mucositis. For this also, You have treatments. Alopecia is hair loss, which is temporary, but of course it causes discomfort and you have that social stigma kind of a thing. But this is reversible. Other side effects are mutagenicity and carcinogenicity. It can lead to infertility if some hormonal treatments are given, nephrotoxicity, cardiotoxicity, and neurotoxicity. These are some of the other side effects of chemotherapy drugs, right? Now, whenever we have these chemotherapy drugs, especially your orals and injectables, when anything new comes, we share new studies, new scientific data with our doctors, right? So we discuss the references or the reprints, the full text articles. So they are basically nothing but studies. So you should know certain terminologies which are used in the studies. So what do you mean by phase 1, phase 2, phase 3, phase 4 study, and the different type of trials. So I'll just quickly take you all through that. So whenever you have some reference papers or you study a product, you can correlate and understand. Clinical trials in cancer, scientific study of how a medicine or a treatment works in people. It is carried out in 4 phases. In phase 1, for any molecule or a combination to get its approval, you have the 4 phases of clinical trials. What is done in phase 1? In phase 1, you monitor the side effects, the pharmacokinetics of the drugs, and it is generally done in about 12 patients, right? The phase 2 study is the one which is done to check the dose of the drug or the combination, and also to see whether the combination of the drug is effective and the efficacy is there or not. The number of patients is 50 to 300 in phase 2 study, but in phase 1 study it is 12 patients. In phase 3, which is the most important phase for us, because a new drug or a new combination gets its approval on the basis of the phase 3 studies. So whenever you're discussing any reference paper or any article to a doctor, the doctor will always want that you should give them a phase 3 study and not a phase 1, phase 2, or a phase 4. Phase 4 is still okay, but not phase 1, phase 2. They would want a phase 3 study which talks about, which is very important. Why? Because in phase 3 trial only you compare a combination or one drug with the previous standard of care. Okay, so you're comparing the new molecule or the new combination with the drug or the combination which was previously being used, and after you compare and you find that the drug is good, only then the drug or the combination is good, only on that basis they will get its approval. Okay, then the FDA will give approval for, US FDA will give approval for the combination or the drug. So phase 3 trial is the one which actually decides whether this combination or the drug is suitable for this particular group of patients or not. Okay, so this is the most important phase for us. Phase 3 is comparing efficacy and safety of new drug with the standard treatment. Generally here the group of patients is very large, 250 to 1000 patients. Okay, because here you're going to decide whether the drug or the combination is going to be approved or not. Yeah. Phase 4, yeah. Phase 4 study is to detect adverse effects missed out in earlier phases. This is called as post-marketing studies. See, a phase 2 study is to detect the adverse effects. In the phase 2 study, we had seen uh, dose ranging efficacy. In the phase 1 study, we saw the pharmacokinetics. We also saw the side effects of the drug or the combination. Yeah, but those were the initial side effects which were seen. But later on, what happens till the after some time when the drug is already in the market, you get to know that there are some more adverse effects or more side effects of the drug or the combination. But that is at a later stage. Okay, so later on, the pharma companies, they do conduct trials and check if there are any other additional side effects or adverse effects which are seen which were missed in the phase 1 study. So that is phase 4 study. So that generally companies keep doing. So here the number of patients is not that particular, but they keep doing these studies and they keep collecting the data and information and keep posting and updating the information. So this is also called as PMS or post-marketing studies. This was with respect to the different clinical trials. Now, when you talk about the various studies, and especially the reference papers, you will come across these terminologies like open trial, open blind trial, uncontrolled trial, double blind trial, and all these things. So, what do you mean by these type of study designs? So, if it is an open trial, that means this is a type of study in which both the doctor and the patients are aware of the drug or treatments being given. If it is an open study, that means the doctor and the patient, both of them know which is the drug they are getting in the treatment. But if it is an uncontrolled trial, a study in which all the participants are given a treatment and simply followed for a period of time to see if they improve, with no comparison against another group. A clinical study that lacks a comparison is called as uncontrolled trial. So here, this is a study in which all the participants are given a treatment. They are followed for a particular time period and it is seen whether it is giving any improvement or not. But they are not compared with any group. So it is just one study, one set of patients, one group of patients, and one set of medicine, one set of protocol, or one set of drug which is being given, and then it is monitored for improvement and efficacy. So it is monitored, but here it is not compared with any other group, so it is called as uncontrolled. Controlled study is a study that compares one or more intervention for up to one or more control groups. A study that compares one or more intervention, that means it has been compared with one or more groups of patients with one or more group of drugs. So that is controlled trial. So in uncontrolled, you don't compare it with any group, but in controlled trial, you compare with one or more groups, right? Then you have randomized study, a study in which the participants are divided by chance into separate groups that compare different treatments or other interventions. In randomized trial, what happens is you have a certain number of patients. Supposing you have 200 patients. Here, the 100 patients will be given will be in one set of group, 100 patients will be in one set of group. But they are divided randomly. It is not chosen which patient is going where and why, etc. Randomly, one patient is put on one group, one patient is put on the other group, but divide equally. So the entire group is divided equally into two and randomly sent to the two groups, and then the efficacy parameters are monitored. So what do you mean by double blind? In the context of a clinical trial, double blind means that neither the patient nor the researcher knows who is getting placebo and who is getting the treatment. Okay, here in the double blind, no one knows nor the researcher nor the patient which drug who is getting, or it is placebo, or which is who is getting placebo, who is getting the drug. No one knows anything. So that is double blind. In single blind, here the researcher, but not the subjects know. Here in single blind, the subject, that means the patient does not know, but the researcher knows which is the active medication being used for the treatment. Okay, and we had seen open study. In open, it was doctor and the patient who knew what the treatment is with. Okay, these are all the various study designs which you will come across when you read the various reference papers and when you keep studying the different articles. So you will come across all this when you uh, study more and more about this, right? So this was all from my side for basics of oncology in part 2. Any questions or anything that you have? Anyone, any questions, any doubts? Hmm? Anyone? Anyone? Yeah. Yes.
Yeah.
I can't hear you all properly.
Yeah.
There's a lot of echo. Can one of you all speak? Yes. Anyone has got any doubts?
We haven't any doubt.
No doubts?
It is clear.
Very clear? Okay,
Yeah.
okay.
Thank you
That's
for the.
good. That's good. I will send the slides to you all so you can go through it. Plus, I will also be sending you all the recording. Yeah. So what I'll do, since you all don't have any doubts, I will break. My other colleague will continue with few products today. Okay. Okay. So my other colleague is going to join. So you all please be online. Yeah. Don't leave the meeting. Wait.
Okay. Okay. And,